So now we're going to talk about benzodiazepines. Basically, it increases the frequency of GABA A firing. Okay, so the benzodiazepines bind to the GABA A receptor, as well as alcohol and barbiturates, and it increases the frequency. Okay, the frequency of and GABA A is a chloride channel, increases the frequency of the chloride channel opening. Okay, and it also does some interesting things. Okay, so you use it to treat sleep and seizure disorders. Sleep disorders as in like insomnia, and seizure disorders as in just like increased glutamate, or some sort of mass effect in the brain. But basically what happens is you have these overactive disorders, okay? So the overactivity is caused by a stimulation of different things in the brain. And basically, GABA is a chloride channel, so it decreases the rate of firing of these things. So if you increase the frequency of the chloride channel opening, then you have a decreased activity, okay? So you use this to treat overactive disorders. And basically, how they work and their side effects depends on half-life. So the short-acting benzodiazepines are triazolam, oxazepam, alprazolam, and midazolam. And all the benzos end in zolam or zepam, okay? And these are the short-acting ones, which means their effect wears off within 10 hours. So just think of tome, okay? But there is also another T benzodiazepine, so you have to think of triazolam as well, okay? So tome is the short-acting ones. And here you have an increase in effect over a short period of time, and however, that increases the rate of addictiveness, okay? Because you have that burst of inhibitory effect, then you go into withdrawal quicker, so which leads more substance abuse potential. So the next is the medium acting, and then you have lorazepam, istazolam, and temazepam. Okay, so here's LET. So you use LET as the medium actings, okay? But the T is different. Temazepam is in the medium acting group, and triazolam is in the short acting group, okay? So you just have to memorize which one is in which, and then let the mnemonics do the work for you for the rest, okay? And these are medium acting, so it has a medium range of time in which it is effective, and it also has a medium amount of substance abuse potential, okay? So it's kind of in between the short acting and the long acting. So the next group is the long-acting benzodiazepines, and here we have C, C, D, F. So unique letters compared to the short and medium-acting ones, and you also have the two ones that have the weirdest names. So you have chlordiazepoxide, chlorazepate, diazepam, and flurazepam. Okay. Now the interesting about this is that you have long-acting, so they have an effect for for days. Okay, but the thing is, they have a low potential for abuse because they have such low stimulation over a long period of time. Okay, but the other thing about this is that they cause so much drowsiness. They cause daytime drowsiness, ataxia, all this stuff. It's a long inhibitor of all your actions. So unlike short acting, which inhibit your actions for a short period of time, these inhibit your actions for a long period of time. So that's why you get daytime drowsiness and whatnot. So you have to watch out for that. And here I'll just add some notes that go along with benzos. So if you take benzos for sleep, you have lowered REM. You have a lowered REM cycle. Okay. When compared to barbiturates, you have a lower risk of respiratory depression, and coma. Okay, so you have a lowered risk of respiratory depression and coma compared to barbiturates. And one of the last things you need to know is that you treat the overdose. Treat flumazenil. Okay, so think about nil, flumazenil. It just nil. It nixes it. You get rid of the benzodiazepine effect. It's a competitive antagonist of the GABA receptor. So you use flumazenil or nothing to get rid of that effect. Okay, and that's pretty much it.